Hello, everybody. Let me give this thing a minute to set up. All right. Hello, everybody. Welcome. Happy Thursday, or whatever day you're watching. I hope everybody's doing well. Remove, remove, pin comment. Okay. Nice. There's this little Eventbrite link that's pinned. Please ignore that. That has nothing to do with today's live. Where is everybody? Hello. Well, anyway, it is 8:31 and we are getting started. Hello, special needs super moms. Welcome. My name is Imari Ventura Rochez. If you don't know me, I am a speech language pathologist, educational administrator, and special needs parent coach. I am also a mom. So I know the struggle. How's everybody doing? Please come on in. Today we have a Facebook Live. Oh, you guys, Happy New Year. I haven't said Happy New Year, but Happy New Year to everybody. Today's January 9th, so it is still okay. It's still appropriate to say Happy New Year. Happy New Year to everybody. I hope that you all had a wonderful holiday. And for those of you who had 2 weeks off between Christmas and New Year's, that was nice. I hope everybody enjoyed. I hope everybody had a great time. I hope that you feel refreshed and renewed and ready to start the new year with purposeful intentions, with energy and vigor, and with positivity, above all, love. Welcome. So, today's Facebook Live is Mealtime Struggles, Navigating Sensory and Functional Feeding Challenges. And that is a mouthful as we are about to talk about food. Navigating sensory and functional feeding challenges. So I'll tell you how I came up with this topic. It is because you guys know I am both a speech language pathologist and an educational administrator. So I speak to parents all day. And so lots of times parents are telling me their kids won't eat, right? And they ask for feeding therapy. And so I have to, once they tell me they don't eat, I have to follow up with some more questions to dig a little deeper and find out why they're not eating. And so the reason why children are not eating usually falls into one of two categories. Either it is a sensory feeding challenge or it is a functional feeding challenge, okay? So let's talk about what that is, all right? I'm going to flip that around and give you definitions, starting with functional first. So a functional feeding challenge, and if you see me glance over, it's just because I have my notes. A functional feeding challenge means difficulties related to the physical, anatomical, right, the anatomy, or medical factors that directly impact the ability to eat. All right, so anatomy, physiology, which means the function, or motor related issues. So essentially, there's something wrong with the structure of the mouth that is not allowing it to function correctly. All right, structure has to be impacted for therapy to work, for function, okay? And I'll give you guys an example that is kind of unrelated to this. I saw a young woman for a consultation last week. She is 33 years old. She has braces. She has a treatment plan for these braces, right? However, she has a tongue thrust, okay? Her teeth are not going to be aligned and her treatment plan is not going to be resolved until she fixes the tongue thrust. So we cannot move on with function until in this case, fixed structure, okay? In the case with the tongue thrust, this is how they're different and how they're impacting each other. So function is what you think of function, and structure is a part of that. Opposed to sensory feeding challenges are rooted in sensory processing differences where a child responds to the sensory aspects of food. So we have five senses, if you didn't remember: feel, look, taste, sound, smell. Okay? And so when parents tell me he's just not eating, it can be as a response to a sensory aversion, right? The child doesn't like the way the food looks. No, mom, I don't like the way it looks. A child doesn't like the way the food tastes. It's too salty, it's too sweet, it's too greasy, it's too bland, whatever. The child may not like the way it smells. You know, a lot of odors are off-putting. A child may not like the way food feels in terms of temperature. Okay, a child may not like the sensory feedback after the chew or the bite. All right, so this impacts their willingness to eat. Sensory processing issues impact the child's willingness to eat. Functional feeding challenges are internal. Okay, they have to do with the way the child's anatomy is functioning. And sensory feeding challenges have to do with the external, right? The way the food looks, feels, tastes, sounds, smells. All right, just to give you a point of reference. Now, in today's live, we're going to talk about the common causes, because a lot of parents want to know why. Why isn't he eating? And if you saw my post leading up to this Facebook Live, I spoke about how it could be really concerning. It could be really scary when your child, for example, just drinks milk or just eats chips or just wants goldfish or just has spaghetti or just wants French fries. This is what I hear. Or they just have Doritos. It can be very concerning when their diet is limited to a couple of different things because you think they're not meeting their nutritional standards. So we'll talk about common causes. We'll speak about typical behaviors. Okay, we'll speak about assessment indicators and intervention strategies. Lastly, there is some overlap, and so we'll discuss that too. So let's start with common causes. I want to let you guys know this live is a little bit different because in this new year of 2025, I am taking questions and answers. Okay, I had some new people join the group and ask about joining the group. So you can ask your questions in this live. The live will be up, it'll be posted here in the group. You may be able to find it on YouTube, but I won't be there to answer your questions. So please drop your questions in the chat with Q hashtag and I will get to them. Functional feeding challenges. What are the common causes? Number one, oral motor delays. Okay, so difficulty chewing, difficulty coordinating tongue movements, difficulty coordinating respiration with swallowing. Ladies, whenever anybody swallows, they must arrest breathing. Okay, we cannot swallow and breathe at the same time. We've got the trachea, we've got the esophagus. They are side by side. They share a wall of tissue, okay? The trachea, there's a flap that must cover the airway in order for the esophagus to open up so that so that food doesn't go down the trachea and into the airway, into the lungs rather. Food must go into the esophagus, down the esophagus, into the stomach, okay? So there's a flap. Some challenges, some causes of a functional feeding challenge may be difficulty coordinating that respiration with eating, with swallowing, right? There could just be a delay in timing. Also, chewing, right? Coordinating tongue movements. There are 4 phases to a swallow. and they all require oral musculature movement. And so at any point, if there is a hard time coordinating that, then we have a functional feeding challenge. Number two, medical conditions can be a cause of functional feeding challenges. For example, medical conditions like acid reflux, cleft palate, okay, swallowing disorders, or gastrointestinal issues. These are reasons for common causes, rather, for functional feeding challenges. Um, Number three, weakness in oral musculature. You have to remember that the cheeks, the tongue, the lips are all composed of muscle. Okay? Muscles can be strong or muscles can be weak. If muscles are weak, then they are inefficient, they are delayed in doing what they need to do. So, weakness in oral musculature is a common cause for a functional feeding challenge. Lastly, developmental delays affecting motor skills, right? Remember, we spoke about this in another live. The cheeks, the tongue, all of these muscles, they are fine motor. They are fine motor muscles, okay? This is fine motor, small muscles. I mean, a very gross generalization is that fine muscles are muscles from the waist and up, okay? And so your oral musculature is part of that. So any delays in fine motor, you have to assume, right, before you can rule it out, that the oral musculature will be delayed also. Okay, now let's shift. Common causes for sensory feeding challenges. Number one, sensory over responsivity. For example, gagging at certain textures. Some children really just have, significant responses to different textures, to different stimulus into the senses, okay? To that feel, look, taste, sound, smell. Children respond differently to different things. They might gag on oatmeal, all right? They might not like it. And a big indicator is that if a child doesn't want to touch something wet and mushy, they probably don't want it in their mouth. Number two, common causes for sensory feeding challenges. Sensory under responsivity. For example, a preference for strong flavors or extreme textures, carbonation, and spice. I do see a little guy for therapy who really he's under aroused, right? His system is under aroused, and he really likes spicy food, and he really likes carbonated drinks, and that helps to self-regulate. And so a sensory under response, meaning that they need a lot of arousal, strong flavors, pungent smells, and things like that, may be the common cause of a sensory feeding challenge. Number three, atypical sensory preferences due to autism spectrum disorder or sensory processing disorder. Please remember that food and feeding challenges is not exempt from the disorder, okay? The disorder will show itself at the dinner table. I'll say that again. The disorder will show itself at the dinner table. So if your child has a sensory processing disorder and they don't like certain textures, and they need deep pressure, and they like to crash into things, there is some sort of representation of that at mealtime. Okay? Number four, common cause to a sensory feeding challenge. Avoidance of foods based on visual or tactile characteristics. Some children just don't like the color green, and they just won't eat anything that's green, right? In my webinar entitled Picky Eating, Problem Feeding that I did last spring, I think I did that in April, I I surfaced some research which indicates that children who are on the spectrum are even sensitive to brand packaging. Okay, so that means that they will have, I mean, you can buy the Pringles, and I am not endorsing any chip. For example, a child may know, right, and recognize Pringles, but if you buy an off brand and offer it to them, they may not want it, right? A child with a sensory feeding challenge, you know, are aware and sensitive to brand packaging. Or there's some cookie brands that stamp their name on the cookie. And so if a child with a sensory feeding challenge doesn't see that, they may be likely not to eat it. Maybe a common cause of the feeding challenge. Very nice. Let's move on to typical behaviors, okay? Starting with functional feeding, functional, remember that's internal, function and structure. The typical behaviors of a functional feeding challenge: difficulty managing food in the mouth. Difficulty managing food in the mouth. For example, choking, pocketing food in the cheeks, right? Just not being able to manipulate food in the mouth and really go through the phases of a swallow. Number 2, fatigue or poor endurance during meals. For example, slow chewing, partially chewing, right? Minimal spoon stripping, delayed transfer backwards, and these are all indicators of muscle weakness, right? Remember, we said that functional has to do with structure, okay? We're talking about how the muscles are working and moving themselves. Typical behaviors of a functional feeding challenge are just not having the strength in those muscles to chew and chew and chew at it and chew at it. And spoon stripping means that you go in, you get some of that applesauce or something, and then not be able to clean the spoon. Okay, with strong muscles, strong oral musculature for feeding, that spoon is stripped bare. It comes out clean. But when it's not, and you can look at infants who just are starting, when that spoon is not clean, there is weakness. Okay, the propelling back is really important. So when a child is not doing that, it's a typical behavior of a functional feeding challenge. He won't eat well. He may have a functional feed. The muscles just may be very weak. Okay, number 3, refusal to eat due to discomfort. For example, pain from reflux or dental issues. Okay, I want you to know, and it is a big misconception, that if a child is hungry, they will eat. This is old school thinking, right? If he's hungry, he'll eat. I want to let you know that pain trumps hunger every single time. If it is too painful to eat, the child will not eat. They won't. It doesn't matter how hungry they are. It's a safety mechanism to stop and not go forward. Number 4, a typical behavior of a functional feeding challenge is a preference for liquid or pureed foods over solids. Why, Mom? Why a preference for liquid and pureed food over solids? Because it's much easier to tolerate and it's much easier to manipulate. Remember, in a functional feeding challenge, the muscles are weak. The muscles are discoordinated, okay? There is limited range of motion to do that, all right? So, pureed food that I don't have to work at, doesn't need to be chewed, minimal mastication, anything I could just, a little bit and swallow it. High preference for that type of stuff. The pouches. Ooh, I can't stand pouches. But pouches, for example, right? They always want a pouch. The pouch of yogurt, the pouch of applesauce, the pouch, because it's easier to do. It's not painful. It doesn't require a lot of work. It bypasses lots of the stages. There's no need to activate my tongue to propel food back because the pouch just squirts. Dangerous. Okay, let's shift into typical behaviors for a sensory feeding challenge. Remember, sensory feeding challenges have to filter through the five senses: feel, look, taste, sound, smell. They are external. Number one, a typical behavior is avoidance of specific textures, colors, or smells, right? We keep seeing that. This is, I'm like, keep repeating myself. And I don't like the way the child doesn't like the way it feels, doesn't like the way it smells, it looks, doesn't like something about one of the five senses as it pertains to food. All right? Number two, a typical behavior of a sensory feeding challenge: overwhelmed by mealtime sensory environments. For example, noise or strong food smells. Yeah, right? Overwhelmed by mealtime sensory environments, noise, or strong food smells. Okay. And can I tell you something as we go through this? Since you have more control over the environment than you do a person's anatomy and the function of their oral muscles, sometimes it's easier to adjust, right? The sensory aversions for a child who doesn't eat. And when you're able to do that, then you can rule out which one it is. Okay. And I say that because noise and strong food smells, right? I'm thinking of a kitchen very busy with the clanging pots and pans. That could trigger a child with a sensory feeding challenge. And a lot of those things could be minimized before mealtime. Okay, number three, typical behaviors of a sensory feeding challenge: rigid food preferences. For example, only eating one brand of food, or one type of food, or one color of food, one food class, right? I've had parents tell me he only eats French fries and drinks milk. He only eats bread. He likes pizza, but only from the pizza shop. All right. So this is a sensory feeding challenge. Number four, aversion to trying new foods. And that is, if you ever do some research, also referred to as neophobia. The fear and the aversion of trying new foods. All right. Let's move on to assessment indicators. Because before you bring this observation, my baby's not eating, my child's not eating, before you bring this observation to a professional, there's some probing that you could do at home, right? And you can use these points that I'm about to say to help you figure out which one it is. You can also list them as observations and share them with your pediatrician. For more on how to communicate with your pediatrician, check out my special needs list for healthcare for special needs children. Okay. Assessment indicators for functional feeding challenges. Remember, functional is internal, within the child, their function, their structure, how things are working. Assessment indicator number one: feeding therapy assessments may reveal physical limitations. For example, a poor lip seal. The lip seal at rest should be closed like this. When we see it's open like this, we know that there's muscle weakness. It seems minute, but it reveals a lot. Weak chewing, okay? A feeding therapy assessment may reveal poor lip seal or weak chewing, okay? Another assessment indicator, number two: Medical evaluations may show underlying conditions. For example, reflux, a tongue tie, or esophageal issues. Okay, so there are in a functional feeding challenge, there are deeper issues. Okay, there's probably a comorbidity, meaning there is another diagnosis happening at the same time, right? That may be below the level of the oral musculature. A tongue tie is at the level of oral musculature, but can sometimes create a functional feeding challenge. Ask this mom. My youngest has a tongue tie, and breastfeeding was very painful, and it was a little challenge at the beginning. Okay, number 3, functional feeding challenge assessment indicator is difficulty progressing from one developmental stage of eating to the next. Okay, for example, from purees to salads, from purees to solids. Puree to solid is like 2 developmental steps. It's really puree to chopped meats or chopped solids. Okay, remember, the easiest is when you look in the store, and really you got to go back to my webinar, picky eating, problem feeding, to understand the developmental stages of feeding. So just for example, stage 1, food, stage 1 in the grocery store, pouch, or if the jars, stage 1 is 1 ingredient, it's 1 tone, 1 note, they're consistent, and they're easy to eat. Okay, if a child is going from stage 1 to stage 2, which is stage 2 is 2 ingredients, usually a little bit more texture, like a chunk, could be some chunks in the puree. If they're having a hard time, there may be a functional feeding challenge at play. Okay, and so if you recognize that, you are like assessing, you are probing. That is an observation to share with your pediatrician, who will make the referral. All right. A sensory feeding challenge. Sensory. So we're shifting. Remember, sensory is external. Think of 5 senses: feel, look, taste, sound, smell. The first assessment indicator, number 1, patterns of sensory aversion. For example, refusal to touch food with hand or explore new foods. Okay, so you'll easily recognize the sensory aversions. That's just that the child doesn't like either the feel, look, taste, sound, or smell of a food, but it's a pattern. You recognize it happen, consistently over time with the same things or similar food items. Okay, number 2, sensory feeding challenge assessment indicator is evidence of sensory differences in other areas of the child's life. All right. So for example, they don't like certain clothing textures. They don't like loud noises. So them not liking certain foods falls into those characteristics. And this is a sensory feeding challenge. Okay, so I hope that this is beginning to help you, moms whose kids are picky eaters and problem feeders. I hope that I'm helping you to distinguish, right, which is which. Okay, let's talk about intervention strategies, because really this is what you need. You need actionable tips and techniques on what to do because your child's not eating. So if it is let's talk about functional feeding challenge. Remember, function is structure and how is it moving, how is the musculature functioning. If it is that, your first intervention strategy is focus on addressing the physical or medical root cause, working with a speech therapist on oral motor skills. Okay, So your speech therapist, if anybody in here, their child goes to feeding therapy, please like let us know any tips that you have learned, anything that they sent you home with that is helping, right? But the intervention really does work. And oral motor, there's a lot in my field, there's a lot of controversy over oral motor exercises, but for feeding, they can be very useful. For speech, not so much. But for feeding, they can be very useful and effective. Okay. Number two, intervention strategy for a functional feeding challenge. Use adaptive equipment. That can be a game changer if you find the right thing. For example, specialized utensils, modified cups, or straws. Okay. I would start with a chubby straw, like a wide, you know what I'm talking about? Not a slim one that we use as adults, like the milkshake straws. These things work, okay? I'm not a fan of sippy cups. I think they do more harm than good. I'm not a fan of pacifiers. For teething, there's some nice little mesh nets that you could put fruit in and allow your child to suck, right? If there's a goal around that. But I do believe in trying out adaptive equipment to help the functional deficit. Okay, great. Number three, intervention strategy for a functional feeding challenge is treatment of the medical issue. For example, reflux medication if acid reflux is the issue, or surgical correction for cleft palate, right? Or to snip the frenulum, that thing, to snip it when there's a tongue tie. You have to speak with your physician about it and understand every single thing. Okay, understand what it's for, what's going to happen, how the anatomy is going to change. To make goals in speech therapy, when there is a structural issue, we're not getting anywhere. I don't know, some of you might have heard my experiences on the cleft palate team in Africa. In order to proceed and work on feeding and work on respiration, even bottle feeding, we were doing that. The kids had to have their cleft repaired. So it's important to work collaboratively with your physicians and therapists on functional feeding intervention strategies. Okay, shift. Let's talk about sensory feeding challenges for intervention strategies. So, this is my number one advice to parents when I speak about them. Okay? Gradually desensitize the child to sensory stimuli through food play and exposure. This is what works. It is cumbersome. It requires a lot of patience and it takes time, but you have to do it. What does it mean? If your child is not eating, if they don't like green and they don't like mushy, or if they don't like crispy and they don't like wet, whatever, you have to do food play. They have to engage with the food in a way that there's not a lot of pressure to eat, that they get to dip their fingers in it, that they get to play, they get to vroom. So you can take a celery, you can put a little bit of some type of butter your child is not allergic to. I'm sorry, I don't mean to laugh at the allergies. It's just there's so many. When I was a child, a lot of this stuff we didn't have. So they have to engage, right? They have to do that. And then put raisins in the boat for people. Okay? And then you have to play with it, and they have to play. And guess what? As they're playing with the celery, that's a boat with peanut butter inside, and they put the passengers in it and they navigate, a little bit of peanut butter gets on the fingers, and then they lick, and then they are engaging and they are desensitized, because even though it's brown and it's mushy, it's not ick. and they licked it and it's okay because it's kind of sweet and kind of salty. And so then the next time that you offer it, there's already been exposure and an association, and it's not that bad. So that little lick of the fingers can turn into a bite, and a bite can turn into half the plate, and then half the plate can turn into a whole plate. So this is the reason behind food play, because it is cumulative, and it really it helps the child to realize, um, to get involved with food, and to sort of break down the barriers that they have, um, as it pertains to certain textures, the way things feel, look, taste, sound, and smell. Okay. So you have to do the food play. Next week, I'm doing a feed, the whole week, I'm doing a pediatric feeding consultations the whole week. You got to schedule and get in touch with me and we can talk. But that is a piece of advice. I will get deeper with it. Just make sure to schedule your consultation next week. Okay, number 2 intervention strategy for sensory feeding challenges are sensory-based feeding therapy. Okay, using sensory bins or structured food hierarchies. All right, sensory bins are wonderful. I love them. I remember as a therapist in the schools, I use them, and so that, I mean, everything's on Amazon. You can go buy one, but you can also make one. So whatever the target is, you know, I wouldn't say candy. I'll just give you an example of what one sensory bin is that doesn't have to do with food. So, if I'm gonna read a book about monkeys, right? And maybe I have plastic toy ones and we're working on counting, I'm gonna get a bin and fill it with cotton balls. And then I'm gonna place things inside so that my child has to go through that and pull out the target, whatever we're doing. Okay, so it's a lot of fun, and it can be used during feeding therapy also, right? You can use rice, and then whatever the target is, plant it inside and have the child go through the bin and take it out. So it's a fun activity. Okay, number 3 intervention strategy for a sensory feeding challenge: environmental modifications to reduce sensory overload during meals. That means change up the environment. The nice thing about sensory challenges is that they are workable. You can work around them. You just have to observe your child, watch what triggers them, and then eliminate that from the environment. So, for example, if you know, you're cooking in your kitchen, you got the music going, clanging the pots and the pans, you might have to turn all of that off and then invite your child to the kitchen to eat. Okay. Maybe you want to open a window while you're cooking so that the odors leave, and then invite them into the kitchen. Whatever it is that is to overload, you know, remove it, right? Because the tongue, there's so many nerve endings on the tongue. So besides everything happening in the environment, there are all these taste buds that are being activated, right? And then there's the satiation feeling. So, you know, we're getting full here. My stomach's getting full. There's a lot going on. So just try to reduce the amount of stimuli in the environment. Okay. So we spoke about common causes, typical behaviors, assessment indicators, and intervention strategies, as those 4 subcategories pertain to functional feeding challenges and sensory feeding challenges. Okay? I want you to know there is overlap. Children may present with a combination of both. Okay? For example, a child with a cleft palate issue may also develop sensory aversions due to a history of negative feeding experiences. Okay, I would say that this is the most severe example. I'm here based in the United States. I know that, you know, we have people in our group worldwide. And so, however, here in the United States, the incidence of cleft palate is not very high. Although I have had a child in the public school system, I have had a child with a repaired cleft on my caseload. Um, but I just want you to understand that the two categories, sensory functional feeding challenge and a sensory feeding challenge and a functional feeding challenge, overlap when a child has a structural issue, perhaps. And then because it's been so difficult, because it's been so painful, doesn't have to be cleft lip, could be esophageal, right? Could be that they have I have children on my caseload with gastrointestinal bags, right? They have a bag as part of their lower GI tract. And so because it's just been so uncomfortable and so painful and so unpleasant to have a meal, there is then an aversion developed as a result. Okay, so that is some of the overlap that happens. I've had a great time. I'm so glad to be here on this Facebook Live in the new year. Happy New Year to everybody who is just jumping in. This has been navigating. Mealtime struggles, navigating sensory and functional feeding challenges. I do hope that you have learned something and that you are now able to approach mealtime with more confidence and understanding. Next week, okay? Say next week. Next week, I'm going to tell you the dates. January 13th to January 17th, I am conducting, I am holding pediatric feeding consultations. Check out my monthly focus. It was formerly monthly month at a glance. Check out my monthly focus to write down those dates if you didn't get them. January 13th to January 17th, I am opening up virtual office hours for parents in New York, Connecticut, and Massachusetts who have issues and problems and need to talk to me about these issues that I just taught on now. So please get in touch, schedule your consultation so that we can chat about it. Once again, my name is Imari Ventura Rochez. You can call me Imari. I am a state licensed speech language pathologist, educational administrator, and special needs parent coach. This has been Mealtime Struggles. I am so happy to see everybody. I am wishing you a happy Thursday night, right? A very good weekend and mealtime fun, right? So much of family and culture is around food. And so I am wishing every single one of you better meals, better meal times. So everybody have a good night and take care. I will see you guys soon. Bye.